Hi, today I'm going to be starting a video series where we talk about the different phases of COVID because I haven't seen a lot of people actually dive deep into this. It's sort of just assumed, but the language has been evolving over the past several years. So I think it's time to sort of rewind to be able to have a unified language to move forward with. So we're going to start with the acute infection phase of COVID. So to give you an instance or an example of why I'm even doing this, there's the acute phase, there is the post-acute phase, which is everything after that initial infection, there is post-COVID complications, there's long COVID, there's viral persistence, there is the IACC, which is the infection-associated chronic condition, which is a new term. So I'm going to try and break all of this down so that we can understand the disease a little better because it's a lot more complex and nuanced than just you're sick and then you're not sick type of thing. Now, holding true to my word, let's start from the very beginning. So COVID is a RNA virus. Its name is SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2, because there was SARS-CoV-1, which came out or emerged many years ago in the early 2000s. And now this is the second instance of a coronavirus spilling over from a zoonotic population, from an animal population into a human population, causing severe illness in people. So its nickname very quickly became COVID-19 because it became a widespread pandemic in 2019. That's when it emerged. And then it's also called COVID. And some people have given it cute little nicknames like Miss Rona. Now, SARS-CoV-2 has essentially two main proteins that are how it functions. So there's the spike protein on top, the S protein, and then that squiggly line inside, that's the N protein, the nucleocapsid protein. Those are the two main proteins in it. It also has an envelope membrane, things like that. But essentially, COVID as a virus, it can't survive just free floating in the air. So this is going to be a little nuanced, so you're going to have to stick with me. So while it can survive in the air, it's not just existing as a virus. It's existing within a liquid particle, which could be a heavy particle of liquid or a light particle of liquid, or within a liquid film, so on a surface. So it has to have this liquid container to be able to hold it and protect it. Otherwise, it instantly dries up and dies. So we do have moisture in the air a lot of the time. So a good example of this is humidity. So when it's very humid out, it feels very heavy and wet on your skin. So that's essentially what the airborne droplets are like. And then the liquid droplets, that's something like spittle on the ground or in the environment. And then a liquid film is interesting. So like if you have a countertop, for example, and you have liquid on it and it dries, well, in the little cracks, you can have a thin film of liquid that takes a very long time to dry, and coronavirus can survive in that very thin film of liquid. So these are the different types of liquids that it has to exist in. So it's not technically a free-floating virus. It's not just existing floating in the air. It has to survive within a liquid vehicle or a container. So you get exposed to COVID, how can it infect you? Well, there's three major pathways that it can infect you through. It can infect you through your eyes, it can infect you through your nose, and it can infect you through your mouth. So how does it infect you in these different ways? So in the mouth, the salivary glands have a high expression of ACE2 receptors and some TMPRSS2 receptors, which can help facilitate the binding of COVID. So those are the two main receptors in our body that you need to be aware of, that you'll hear a lot being talked about with SARS-CoV-2, the virus, so COVID. So the salivary glands is a great place where COVID likes to camp out and replicate. In the nasal passageways, we actually have these things called microvilli, which are like little windshield wipers that help keep our nose clean. So COVID will bind to these and replicate that way and infect us. And then they'll travel further and further into our body as we continue to breathe. And our eyes also have different receptors that allow for COVID to bind to it, particularly near our tear ducts. So they've shown in research studies that through direct inoculation of just the eyes, of just the nose, and just the mouth, you can have a productive COVID infection, and that it will continue. So if you get infected through your eyes, it will continue to replicate and transition down into your nasal passageway in your mouth, so you'd still be able to test for it through just an eye infection of COVID. If you get a nasal inoculation, where the nose is where it starts, then it'll, again, when you're doing your nasal swabs, it'll pop there, but it'll also be present in your eyes and your mouth. And similarly with the mouth, if you get infected that way, if you consume the COVID or breathe with an open mouth, then will show up in the nose and the eyes as well. So all three of these are the pathways that it can get to you through. So with a mask, you're protecting the nose and the mouth, ideally. So that's why you want to cover both your nose and your mouth when you're wearing a mask. And then through your eyes, they found that glasses actually provide a bit of a protective effect. So that's something you can wear as well to help protect you against COVID. So now we know what COVID is. We know the 3 different ways that it can infect you through the eyes, nose, and mouth. So how can you get COVID? How is it transmitted? So if you're around a COVID-infected person, there's several different ways that it can actually infect you, and there's been other ways that have been completely ruled out. So the first is through coughing. So the saliva, remember, through the mouth infection, it really likes to infect those salivary glands. So coughing aerosolizes COVID. So you have liquid particle droplets of saliva that can either go into the air, become airborne. Again, COVID is surviving those liquid droplets from the saliva, or they can fall on surfaces. So that's one route. So sneezing, again, remember the nose infection, so the mucus, when that gets sprayed everywhere when you sneeze, the person can inhale that, or it can get in your eyes, or, just through your mouth. So that's another way. So wastewater testing, we've shown that poop and pee, fecal matter, and urine are positive for COVID. So these are definitely ways you can also get infected. So bathrooms, shared spaces like that. This has been a little hit and miss. Some studies show that sperm is infectious. Some don't. I'd err on the side of caution, assume that sperm is infectious. So if you're, blowing a COVID-infected person, then that sperm, that semen, if you're swallowing, is another potential route you could get infected. So then ways you can't get infected, they've shown that mosquitoes and ticks can't carry COVID. That's phenomenal. We've shown that the acute infection is not passed through the blood. So this is all about the acute infection phase. And then it's also been ruled out in breast milk. So the mother's wearing the mask here. So if they're infected, they'd want to do that since the young child wouldn't be able to wear a mask. But the breast milk itself is not infectious. And now that we know the different types of bodily productions that can cause a COVID infection in others and can be transmitted to others, well, what are the different types of scenarios? So there's airborne transmission, so this would be inhalation, as you can see here. So this can be sharing air with someone that's currently infected, or an infected person has existed in a room with this bottom picture here, and people are just breathing in the air that has not been turned over. So a person's in a room for a long time, virus builds up in the room, and then people breathe that in. You can have direct depositions. This would be someone coughing or sneezing on you. That's how you can get infected. You can have indirect contact or direct contact. So if someone coughs in their hand and then they shake hands with you, and then you're just like rubbing your nose a little bit later, picking your nose or picking something out of your teeth, that's a way you can get infected. Or if someone's like in a conference room, is sick, coughing on it, and then you go into the conference room after them, you don't know they're sick, and then you're like touching the surface, and again, you just like mess with your face, then that's another way that you can get infected by COVID. So these are all different types of infection scenarios. Now, because that got a little technical, let's talk about some more real life scenarios where you could then get infected by COVID. So kissing someone that's been infected with COVID, that has an active infection, saliva exchange, that's how you can get infected. That's one way. You're sharing public transit, so many different scenarios here. So it's an enclosed space, not necessarily having windows open, so air is going to be stagnant in like a bus or a trolley. So you can be sharing air there. That's inhalation. People getting in seats, touching things, touching buttons, pulling chains to be able to stop the bus or trolley or whatever it is, and you touching these things that can be direct and indirect transfer. People can be coughing and sneezing on you if you're sitting next to someone that is sick. Similarly with airplanes and things like that. Sharing drinks with people. So a lot of the times, like when I was in college, we'd all get different drinks and we'd share each other's drinks. It's been shown even with alcohol, because you're touching the surface of that glass, saliva, and again, backspit within your drinks. A lot of people, we just do that. So sharing drinks with other people can pass the infection that way. Again, remember the fecal matter in urine. So things like eating ass, eating someone out, that's something that can spread an infection. We have toilets, so using toilets that haven't been cleaned, and then not washing your hands properly or effectively. That's another way you can get infected. Shaking hands with people that aren't washing their hands or that are coughing in their hands, a great way to spread it. Or just like literally a person that shakes a lot of hands, so like a politician going from one person to the next. That's a great way to spread it as well. Trying on clothes in stores. It can exist on fabrics for a decent period of time. So someone tries something on, they're sick, they put it on the rack, you try it on a little bit later. That's another way. Touching high contact surfaces, so like push buttons, things like that. So maybe just use your elbow or your foot for that type of thing. So it's less likely to like hand to face type of contact. Sharing a meal with someone. So this is actually the safest way to share a meal, is side by side with someone. But if you're sitting across from them, talking to them, then like spittle will go as you're talking. We just spit while we converse with people, some people more than others, but that can get in the food and then you'd consume it that way. Frozen foods. So people that are processing and handling frozen foods could get COVID contaminated on that. And then it actually, when it's frozen, it preserves the COVID for a long period of time, so that when it thaws, it's still active, alive, and infectious. High processing foods. So sushi is something that takes a lot of preparation. So having like the person preparing the food breathing on it consistently, sushi is actually a very high infectious food for COVID transmission. And then like things like having kids. These are all the types of things that can increase transmission. And now that brings us all the way back to acute infection phase of COVID, the acute infection phase. So what is the acute infection phase? This is when you are actually sick with COVID. So the different things that can happen when you're sick with COVID, you're exposed to it, you don't get an infection. In this case, you would not be able to transmit the infection to others because you are not sick. You could be asymptomatic. So what this means is that you are sick, but you don't have symptoms, which is something that can happen. So you're asymptomatic, but you're still transmissible to others. You're still infectious to others. So this is still a sickness, even though you're not aware that you're sick, or not fully aware that you're sick. You could have mild symptoms, so you're just starting to feel sick. Again, you're still infectious to others. You could be moderately, you could have moderate symptoms, so you would be feeling very sick at this point, where you might consider going to the hospital to get checked out, to maybe get IV fluids, things like that. You could have severe symptoms, so this would be emergently sick, like you have to rush to the hospital because you're having trouble breathing, and then you could die. So again, if you're moderately sick, you're going to be infectious to others. If you're severely sick, you're going to be infectious to others. And death is an interesting one. So death, you are in some ways no longer infectious to others, but in other ways you're still infectious to others, because if you died with COVID or of COVID, doesn't matter. In your area where you died, for the immediate period afterwards, you're still having COVID in the air and it's still existing on your body. It can survive on skin for about 8 hours, very long time. So COVID is still infectious in that way. So people can get infected from your corpse, or from the air that was around your corpse when you died, your body when you died. But after that period, it's not infectious to other people. But then there's a caveat, because they found that tissue in your body is still infectious. So when people are doing autopsies, this is a really interesting one. When they're doing the bone saw through your bones, It's aerosolizing bone fragments, and this is actually infectious. So the person performing the autopsy could theoretically get infected if they're not wearing proper PPE through the actual autopsy process, if they're cutting through bone with a bone saw. So it can be infectious once more. So it's sort of like Schrodinger's infection. You're both simultaneously infectious and not infectious because there are certain criteria that would need to be met for you to actually infect other people. But these are all the different ways you can infect people. So early on, we were hoping, scientists were hoping, the public health professionals were hoping that if you were asymptomatic, you would not be infectious to others. So this would be a negative. But we found out that, in fact, you are infectious to others even when you're not showing symptoms, which was unfortunate. So the hope was that with vaccination, we would be pulling high numbers from the moderate severe death categories over to the mild asymptomatic categories. And then when you had more people in the asymptomatic categories, you would have less infections, less people would be getting sick. And that is what we saw. So giving us a little bit of a conceptual model here. This is not pulled from a paper. This is just a conceptual drawing I did. So if we look at these different categories of no infection, asymptomatic, mild, moderate, severe, and death of each one of these little boxes. Early on in the pandemic, before the vaccine, most people that got sick were either having moderate illness, severe illness, or death, with very few people having mild or asymptomatic symptoms. But then the development of the vaccine came around, and so the gray here is going to be that same initial pre-vaccine, and then the post-vaccine will be the dark curve right here. And we did have a left shift where more people were then becoming mildly symptomatic or asymptomatic. Less people were becoming moderately symptomatic and severely symptomatic, and less people were dying. So that was a very big positive impact of the COVID vaccinations. However, as we see here, even though we're shifting people to asymptomatic and mild categories of illness when they're in this acute sick with COVID phase, they're still positive. They're still transmissible to other people. So COVID is still able to spread to others, despite us having this great success in reducing the severity of people being very sick with COVID and then dying in this immediate sick with COVID phase. So, unfortunately, vaccination did not cut transmission of COVID in a meaningful way because even though you're having less symptomatic people or severely symptomatic people, you're still having people that are transmissible to others. So, before we move on to the 3 high risk categories of being less than 2 years old, greater than 50, immunocompromised, let's quickly talk about no infection and what sort of generates this scenario right here where you're exposed to someone but you're not contracting COVID. So there's a couple different scenarios that could cause this. So the first is that there's not a high enough infectious dose during your exposure. So the person was shedding at very low levels of the virus. They were breathing. It just wasn't enough virus to get you infected to get past your initial defenses. So they were probably like coming off the tail end of their infection, or was early enough on in their infection that they just didn't have high enough levels to get you sick, even though you were exposed to them. The second one is that the infectious dose is high enough, so they're like in the throes of their infection, they're very infectious to others, but you weren't around them long enough to get infected because there is a time component to this illness. So this could be like you walked by someone that was sick down a hallway or in a crowded room of people, but even though they were very infectious, you weren't around them long enough to get sick. You could have been like near an open window during contact, so even though you were around them for like 20-30 minutes, you were getting a high turnover rate in the air, so the virus couldn't accumulate around you. Or like you were in an office building, you had like the AC unit right behind you, so it was blowing air at you, which was also pushing virus away. So these are different scenarios that could make it so that you could have been around a person, but not long enough to actually get infected. You were masking, so you're wearing an N95, a KN95, a KF94, or a cloth mask, so the virus couldn't contact your nose or mouth to produce infection, or maybe you're wearing eyeglasses, so it couldn't contact your eyes. You had a recent vaccination with a very high match variant, so you were lucky enough to maybe come into contact with an XFG virus, but you had a vaccination that was close to XFG. I mean, this didn't happen. We targeted the vaccines to different variants. So let's just go back in time and say, oh, Jan 1. So you recently had a vaccine 2 weeks ago with a Jan 1 vaccine, and then you came into contact with Jan 1 or Jan 1.1 COVID. So even though it was high enough to infect you, you were around the person long enough to get infected, you had very high levels of antibodies in your system, so you're able to effectively catch it, fight it off before it could cause a productive infection in you. So that's another scenario, or really just dumb luck. Sometimes the stars align and you just don't get infected even though you should have. Now, despite us nationally doing this leftward shift from a full population level where we're making illness less severe through vaccination, there are a couple groups where vaccination doesn't really do too much. So we have people less than 2 years of age, so young kids. We have people 50 years and older, and then we have immunocompromised people. So starting with young children, less than 2 years of age, mostly less than 6 months of age, but this is true pretty much up to 2 years. We sort of have an interesting bimodal curve. So we have groups of kids that are going to receive maternal antibodies through the mother who got vaccinated in the third trimester. So that's a case where people would have, or young children would have less severe illness if they contracted COVID. We have children that are young that are going to be getting vaccinated because you can receive the vaccine after 6 months of age, which is why I set it to less than 2 years. So we'll have a group of kids like that, but then we'll have groups of kids that did not have antibodies through maternal vaccination, that did not get vaccinated, that are still going to have that moderate to severe disease and high likelihood of death. So we sort of have these two camps in very young children. So why is this? Well, children are immune naive. They haven't built up an immune system yet, so their body hasn't really been exposed to pathogens. They don't know how to recognize it and fight it off. So this is sort of like everyone at the initial COVID outbreak. We didn't have a pre-existing immunity to COVID, so that's why a lot of people are getting very sick and dying. Again, maternal vaccination in the third trimester, the mother is able to pass these COVID antibodies in utero to the child, and then also through the breast milk after they're born to help protect them in early life, reducing disease severity. And again, if you're less than 6 months of age, you can't get vaccinated. So this is a high vulnerability period for these kids that are intended to be vaccinated. And then also we're starting to have barriers within this current administration here in 2025 to vaccination for children by the state regulations and laws. So these are different reasons why we're going to have these bimodal curves. And then as these vaccine barriers go up and up and up, we're going to start to see this one shifting to the right, where we're essentially just going to have a high illness curve for these children. And then also social inequity. So the inability to get medical coverage, not able to afford vaccination through the vaccines for children, not able to participate in the vaccines for children's program or not having funding for that. They can't take the time off to get their child vaccinated even though they want to, or they just don't believe in vaccines for whatever reason. So these are all different reasons why we're sort of seeing this right now in children, why they're still a high-risk group. And then alternatively, we have people that are greater than 50 years of age. This is most pronounced in people 65 and over, but it already begins in people 50 and over, where we start to see this off shift to the right. This is because of immunosenescence, which is just a fancy way of saying that the older you are, the weaker your immune system becomes. It becomes harder for you to fight off infection, and it's the less likely you are, the older you are, to build a strong, sustained immune response to vaccination. So even if you get vaccinated, it's harder for you to sustain that over a long period of time. It sort of fades away faster. You could have compounding medical conditions like diabetes, heart conditions, etc., which are more likely to increase the severity of getting a viral infection. And again, social inequity, the inability to get medical coverage, not able to get on like your Medicare, Medicaid, not able to afford hospital visits, so like not able to get prescriptions for the Medicare, Medicaid. So that would be like the Part D, being able to get Paxlovid covered. Alternatively, it's like I think $1,500 now, which is a huge financial barrier for the elderly. And then Medicare, being able to go to the hospital if you have a COVID infection, get that covered. And then like you might not be able to afford a hospital visit in your budget since you might not be making money anymore, and then you have nobody to take you to the hospital. So you're more likely to just like sit and get sicker and sicker if you're like in a group home or something like that for like the 65 plus crowd, which could be an issue too. And then we have immunocompromised people. So we have this whole thing in this current administration where they're like, oh, just give immunocompromised people vaccination. They're the ones that need it. Well, how herd immunity is supposed to work is that you vaccinate the entire population, you build up this immunity in healthy people, so it protects people that are immunocompromised because their immune systems don't work well. That's what immunocompromised is. It's an impaired immune system. So vaccination might not work in these people because they're not able to mount immune response to vaccination. So they got the vaccine, but their body just didn't respond and produce antibodies like it should have. They didn't develop a sufficient enough immune response. So they did develop an immune response, but it wasn't like a high level of it. So it wanes very quickly and doesn't really protect them that long. Or they develop an immune response, but they aren't able to sustain it. Like their body quickly forgets how to fight it. They could not be able to effectively fight the infection because of their immunocompromised status. So once they get a virus, the COVID virus, they're not able to sufficiently clear it or develop enough of an immune response to combat it. Again, social inequity, inability to get medical coverage, not able to afford a hospital visit, nobody to take you. And then you could be taking medications or receiving things like chemo that further compromise your immune system. So and this could also prevent treatments like Paxlovid and other antiviral medications. You might not be able to take those because of contraindications with the medications you're receiving. So there could be bad effects of mixing these things together that could really harm you. So taking these medications or receiving chemo could further suppress your immune system, meaning that when you have that COVID infection, it's harder for you to clear the virus and you get more sick from it. So these are 3 different groups that, despite us having vaccination now, still are at high risk for all of those various reasons. And then we're going to take a pause here before we go into part 2, but that's essentially everything that goes into the acute infection phase of being sick with COVID. In the next video, we're going to talk about viral load on infectivity and then PCR and rapid test detection, missing infections due to the viral load curve shift that's happened over time, Paxlovid and antivirals, go into a little bit more of a deep dive into that and how it impacts viral load. Talk more about the acute infection duration, how long you're sick with COVID, persistent rebound and chronic infection, which is sort of a second phase of an acute infection. You could just have this extended for a long period of time through these persistent rebounds or just being chronically infected and it not ever going away for a long period of time. So these are all things we'll cover in the next one. Have a good one.